we're ready. We're just giving a minute for everybody to kind of get settled back in after passing out the handouts. Does everybody have a handout from? Hello, can you hear me now? FYI, we're not going to play karaoke because you do not want to hear me sing. Let me tell you. So, does everybody have a handout that from payroll that needed one, and we're ready to get going about employee assistance? Okay. Well, why don't we go ahead and get started? We just love coming in to do this training every year, believe it or not. It's one of the few times that we get to see everybody face to face, that we get to see everybody at the same time. So we are very, very happy to be here this morning. And some of this material that we're going to be talking about, you all have had before, but it's only once a year. So we need to repeat some of this information required by the DOT. Now, I did see somebody yawn back there. Did somebody yawn? A good stretch? But the exciting thing about federal regulations this morning is that we have prizes. So throughout the presentation, we're going to be asking questions about it, and we have prizes for people who are paying attention. Does that sound exciting? All right, okay, prizes. So with me today, I'd like to introduce you to my esteemed colleagues. First is Bobby Jager from the Employee Assistance staff. She's one of our Employee Assistance professionals. Many of you may have talked to her about different DOT issues, about medical return to work issues, and she's a fantastic resource in our office. And then also with us today is Kim Chisholm. Kim does a lot of the DOT work, and she's the one that helps organize our random testing. She does our wellness program, so she's going to be talking with us a lot about the work that she does. So we are very excited to have Kim here today, too. And then I'm Kathy Young. I'm one of the employee assistance professionals. Many of you I have met over the years. I've been with the school system for about 18 years now, doing medical return to work cases, those kinds of things. So we're going to jump right into it and start off with talking about the EAP. How many of you are familiar with EAP? Say, okay. I want to see everybody jumping up and down like, yes, we're familiar with EAP. One of the things that I just wanted to mention to you is that we provide a whole wide range of services. Sometimes people only consider the DOT work that we do or the medical return to work that we do, but we also offer services to employees and family members on a wide range of personal or work-related issues. So if something's impacting you in some way, by all means, give our EAP staff a call, and we are more than happy to help you out. We offer individual services, we offer some work through DOT, we offer support groups. So when in doubt, call EAP and we're more than happy to help you out. And these services are absolutely free of charge. So there's no cost to coming to EAP. We are located, how many of you know where New Directions is? Some of you do that bus run. We're in the Clarendon area of Arlington, right across from Whitlow's, about a half a block up from Whole Foods. We're located at the intersection of Wilson and Fillmore. We have plenty of free parking available. So it's a nice area in Clarendon, but we do have parking available. So one of the questions that we get asked a lot is the EAP confidential? If I have a personal issue, if I have a problem with my, going on at work, why should I come to EAP? Will my employer find out? And the EAP is confidential. One of the things that's important to know is that there are certain aspects of EAP work that we do, such as the DOT work or the medical pieces, that we do need to consult a lot with HR or with the federal guidelines on that. We're going to get into that a little bit later on. However, just if you're coming because you're stressed about a relationship or you're concerned about one of your children, unless required by law, those meetings are strictly confidential. And sometimes the APS will allow you to come at work time. At that point, you do need to let your supervisor know that you're coming. Primarily, those are the medical cases or the DOT cases that we're dealing with. Otherwise, we have very flexible hours so that you never need to let your supervisor know. Most of our bus drivers that come for personal related issues come in between their morning and afternoon runs. However, we do have early morning appointments available. We do have some limited after school appointments available as well. The next slide we're going to talk about is one of the questions in terms of transportation that we get the most questions about, which is why do I have to go through EAP if I have a medical issue? So the reason why, and we hold this near and dear to our heart, is because we have a confidential location to hold on to all of people's medical records. So for example, and can you hear me? I feel like I just went out. Can you hear me? Can you hear me now? Can you hear me now? All right. So let's say we have an employee, I've had an employee that I've been working with that has gone out on a medical issue, and they say, why do I have to come back through EAP? One of the main reasons is just to say if there's any restrictions that are involved, and we just want to make sure that people are able to do their job safely. Now the reason why EAP is involved in this, very important. If you have a medical issue, do you necessarily want everybody to know what's going on? No, and that's exactly why. So we have a place to keep all of the medical information confidential, so that when we talk with your supervisor, or we talk with HR about any restrictions that you may have or your ability to return to work, we're only reporting on your ability to do your work. So that's the reason why EAP is involved in that. We get a lot of questions about that, so if you have any personal questions about that, I would suggest that you talk with Bobby or me after the presentation, because these are really all handled on a case-by-case issue. So, yep, that's pretty much it. And ultimately what we do is we review the restrictions that you may have with your supervisor and or with HR, just to make sure you're safe to do your job.
Any particular questions on that? Pretty straightforward. Good morning, good morning.
Good morning.
Welcome to another school year. It's definitely great to see so many familiar faces. Also want to welcome a lot of new employees that's joining us this year. Is everyone familiar with your site's Wellness Ambassador?
No.
Anyone know who your Wellness Ambassador is? Amber, can you wave your hand? Now you can put the face with the name. I know a lot of new people are meeting a lot of people. She's your go-to person for everything wellness. And what a lot of you may not realize about her is she's often behind the scenes, thinking of different programs and initiatives that's tapered directly to your department. They may not always pan out for different reasons like cost or logistics, but she's always working on something creative just for you guys to keep you healthy and active and productive. So I just want to make sure that I say thank you once again for everything that you do. It's definitely a thank you for that. Many of you probably have seen our monthly newsletters. They're usually by the door and blue. They have a wellness awareness on them. On the back page, they have a healthy recipe. They have our upcoming events that we're having, which I won't give away with a trivia question. But there's always a healthy recipe in there. If you have a recipe that you'd like to share, I'd be excited and honored to feature it in one of our newsletters. With the holidays coming, if you have something that you know everyone enjoys when you cook it and you don't mind sharing it, please give one of us a call, shoot me an email. Let me know when I come down there to visit you guys, and I'd love to give you credit for such a great recipe. Can anyone name 3 of the tournaments that we sponsor every year?
Volleyball.
Who said volleyball? All right.
Baseball.
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 kickball in the fall. We have bowling in the winter. And we have volleyball in the spring. Is Ella here? Ella's here? Well, I just wanted to give her a special recognition because she called me. She had other people call me. She was very, very interested in getting a team together for the bowling tournament. And I just wanted to acknowledge her efforts. She was, she didn't have as many people come down as she wanted to, but it was the first time you guys participated in the bowling tournament, and it was largely because of Ella. So any other people here participated in that bowling tournament? Anybody participate in the bowling tournament? The bowling tournament that we just had, were there any other participants here? So every year we have this tournament at Fort Myer. They usually kind of give us the best rate, and they expect us every year. So I think it's about February, depending on the weather. It'd be great. We'll heavily advertise it. It'd be great if more of you guys can make it. I know your schedules are pretty tight, but everyone had a really great time, and it'd be great to have you guys there again.
We had the largest turnout ever came this year in February. Every lane was big.
So aside from the tournaments that we do every year, is anyone familiar with any of the other programs or the initiatives that we host every year? I heard one person say it earlier. Who said Biggest Loser?
Incentive program.
Biggest Loser? Definitely.
Okay,
Biggest
where is
Loser.
that? Okay.
Any other programs that you can think of? Anything come to mind? All right, we'll let you know what those are. So we have the Biggest Loser, Active for Life, which we have every year in January. We have Healthy Habits that's coming out shortly around the holiday season, and Maintain, Don't Gain. Everyone knows that around, I think they say from Halloween up until the beginning of the new year is when people gain the most amount of weight. So there's no secret or mystery as to why that happens. So we have a program specifically around that, and a lot of schools really have fun with that program.
Okay, thank you, Kim.
We're very proud of our wellness activities, and Kim does a great job running all that. In addition to OSHA, DOT, she wears several different hats. We're going to kind of transition over to talking about what employees need to know about alcohol and DOT alcohol and drug testing at this point, because now, although this applies mostly to the drivers and supervisors, and not so much to the bus attendants, we still ask all of you to hear it. So, why do we test? True or false? APS does not need to have a testing program. They just do it to keep our Arlington County citizens happy. Is that true or false? False. All right, good answer. Okay, so it is false. That's the next slide. All CDL drivers who operate commercial vehicles are subject to the CDL requirements on the public roads in the U.S. and are performing safety-sensitive functions or are subject to the DOT regulations on drug and alcohol testing. True. That is true. So, and so therefore, all of you CDL holders are in what we call our random testing pool. And therefore, all of you who are CDL holders also, going on to the next slide, this one here, the Innova Occupational Health Center. And I wanted Kim to talk about this because this is kind of big news here in our office. We've just been rolling out the news about the new Occupational Health Center, so Kim's going to take it at this point to let you know about it. Okay. So many of you probably are aware that the testing location is no longer on Seminary Road. For so many years, everyone's been reporting there for their random testing. for post-accident testing, reasonable suspicion, things of that nature. So the location has changed. Oh, yeah, thank you. And the physical, pre-employment physicals as well, thank you so much. So the new location, and we have a bunch of directions and maps and everything to kind of help you guys out with that, because I know you guys often drive independently to get you to where you're going, and you can also touch base with Melissa and Darlene and the department as well. But Kathy and myself went down there just recently so that we can be prepared to answer some questions and kind of get a feel for ourselves of the new environment that you'll be going to. So a lot of people are familiar with King Street in Alexandria, and I know a big landmark is near the TGI Fridays, and there's a 7-Eleven and a KFC and a Domino's. It's a big complex.
And a Dunkin' Donuts.
And a Dunkin' Donuts. I'm sorry, I can't remember the cross street. It is, thank you. But it is the Shops at Summit. That's like the name of the complex. And I know there's a new location there on the second floor. So starting very soon, you guys will be going there. We'll start back to random testing now that you guys are all back from summer school. We'll start that. So keep that location in your mind, and Melissa will include those directions and a map in your testing packet that you'll get before you go to the testing facility. They do have designated parking spots for INOVA right in the front of the building as soon as you turn into the parking lot. But if you turn into the parking lot and drive all the way down toward the back of the building, and they do have many signs that says INOVA 4700, there's also an entrance all the way in the back that you can enter as well. Either one, whichever is more convenient for you. You can go into the second floor. Once you're there for the first time, it'll all be more familiar to you. They'll let you know another door that you can enter for convenience. But as always, if you have any questions at all, I know a lot of people don't go for randoms very often. Some people feel like they go all the time and they're an expert on it. But if you're ever confused about where to go, keep the phone number with you, touch base with Melissa or Darlene or myself, and we'll be able to help you out with that.
And I can leave the sheets wherever's convenient here, out at the table, I guess we can put them on the side. There's the website.
Oh yeah, please note the new phone number too. I know some of you guys already have the phone number stored in your phone, but please, the phone number didn't carry over, so please make note of the new phone number in the packet that you'll receive when we're in. So the primary safety objective, and many of you all know this already, so it's just a reminder, is to prevent and deter use of alcohol and drug use while performing safety-sensitive driving functions. Who is subject to DOT testing? Anyone notice? Correct. Those performing safety-sensitive functions. Why are safety-sensitive employees tested? Safety and to ensure compliance. What conduct is prohibited by the regulations? The use of substances, drugs and or alcohol, and those that haven't been medically cleared by your doctor or DOT. And that's always one of those questions that we get every year. Well, what about this prescription? What about this prescription? Unless it's DOT approved, even if your doctor does write you a prescription for it, you're not able to take that medication. You can always call us. Any questions that you may have about it. When in doubt, when you're unsure, just give us a call.
All right, now we're going to get back into quizzing you all to see if you all are awake. And I'm going to start with this group over here, and whoever's hand I see first, you get a prize. Okay? All right, Bobby's going to, my beautiful Vanna White here is going to pass out the prize. So, are you ready? Let's pop that question up, please. Keep going. Keep going. True or false? So we made it very easy for you. Go ahead. Now that marijuana is legal in DC and some states, DOT no longer tests for it. Okay, you, I saw him first, Bobby. Saw him first. False. DOT still tests for it. So what we're going to do is talk about, keep going, false. It remains unacceptable for any safety-sensitive person, employee, to use marijuana. So let's say I go to Colorado on vacation and I come back and I test positive for marijuana. Is that still a positive test? Yes, it is still a positive test. So what we're going to talk about right now is what are the drugs that DOT tests for. And your group here, please pay attention because you all are going to be next. Marijuana. Marijuana, cocaine, amphetamines, opiates, PCP, and alcohol. So I just wanted to make sure that you all know this. So go to the next slide, please. Group number here. Okay, now, are you ready? Name 3 out of the 5 drugs that DOT tests for. Hand first. Okay, lady in the pink. Got the lady in the pink.
Marijuana,
Opiates, okay. Okay. Yep. All right. Give a hand to the lady in the pink. All right. Woo! All right. So just as a review, next slide, please. Marijuana, cocaine, opiates. That includes codeine, where Bobby's going to talk about that later on. Morphine, PCP. Alcohol. Now this is for you all. Are you awake? Are you excited? Is this the moment that you've been waiting for all day? I can tell. All right. You are tested for alcohol at each random test, true or false? All right, I saw the gentleman back here first. True? Okay, let's try that again. You are tested for alcohol at each random test. Okay, lady in the back there, I think. Yep, false, yep. Okay, great. Okay, false. You may or may not be tested for alcohol as part of your random test. How many of you have been tested without being tested for alcohol? Here, anybody randomly tested and not been tested? Yeah. So we do not test for alcohol. Did I miss you? We have an extra one. Are you saying that she with her hand? You've never been tested for alcohol? Okay. So what is considered misuse of alcohol? And I think this is really interesting because a lot of times we get a little swayed by that because alcohol is considered a legal drug. So people are saying, why are we tested for this? So I think it's really important to know that. I've been in this field a long time, about 26 years. And one of the things that I just wanted to mention to you is that I had and this was not a transportation person, so please don't look around and say, was it you, was it you, was it you? That actually got a DUI the next day after heavy partying. His alcohol content was so high, and he got pulled over on the way to work, totally not a transportation employee, and still got a DUI. So please, please, please be conscious of not only your on-duty behavior, but your off-duty behavior as well. So misuse of alcohol, what that's considered is reporting for work or remaining at work with an alcohol concentration of 0.04. Now this person, again, was not a transportation person, got pulled over on his way to work, but had he come to work, it would have been a DOT, and gotten caught up by DOT, it would also have been a DOT violation. So just be aware of that. Using alcohol while performing safety-sensitive functions, performing safety-sensitive functions within 4 hours after using alcohol. So there is a cutoff, so please, please, please be aware of that. And using alcohol within 8 hours following an accident or until the test was administered. So if you get in an accident, do not go to your local bar, don't go to Whitlow's to relax. You need to report to the testing facility first. And if it meets the criteria, Bobby's going to talk about that a little bit later on. And alcohol misuse is a violation of DOT, and it does have consequences. So even though it's a legal drug, please, please be aware of your alcohol use as well.
all right. We're going to transition over to the idea of, we get this question a lot at the office. For years, people in transportation were told to call us if they had any questions about their medication. So I've been trying to redirect people to their personal physician for these questions. We are not the doctor's office. We are not your doctor. If you have questions about your over-the-counter medication, you need to call your doctor, let them know you're a commercial driver, you have a commercial driver's license, you drive a school bus, and that if you have any questions about what they're prescribing you, if you should be driving that school bus, that needs to go to your personal physician. You should also be listing that on your annual medical review with the DOT physician at Innova Occupational Health. So that is not a question for the agency staff. We are not medical personnel. So I just want to make that clear. I try to say that every year. And then going on to the next slide, we're going to have to kind of, in the interest of time. So this is just a quick overview. When can you be tested? There's basically 6 times. Pre-employment, when you're in the process of getting hired, reasonable suspicion for cause, random, return to duty, follow-up, that's after you're coming back to work, or after you've been back to work, and post-accident. And I'm going to quickly go through the next one talks about pre-employment. You are required to submit to a test. In ATS, we do both alcohol and drugs. And sometimes it takes a long time to get the results back. That's an issue we'll work with. Test required reasonable suspicion is the next slide. That means that one or more trained supervisors have reasonable belief that you are under the influence of alcohol or drugs. So, random, truly random. It's unannounced testing. If you have reported to work, you're expected to report to the collection site. No excuses. We often get calls saying, the employee told me he or she has a doctor's appointment at 11 a.m. They can't go to the collection site. That is not an excuse. If you're reported to work, you're expected to go to the collection site. End of story. What's that? Oh, sorry. If you have reported to work, you're expected to go to the collection site on the day of the test. It's an unannounced test. It can't be a random test if you say, oh, I'm sorry, I can't go for my random test today because I have a doctor's appointment. If you have reported to work that day, you are expected to go to the collection site, to Innova, one of the Innova collection sites that day, which are scheduled by appointment. It's difficult to change those appointments. Any questions?
I have a question.
Go ahead.
What would happen if employee refused to go to a random test?
Then we talk about refusal to test, which I'm going to cover in just another couple minutes. We also, next slide is post-accident. That's something that your supervisor would schedule once we hear of an accident. There's certain criteria that meet the criteria for post-accident. Your supervisors are trained in that. And we have return to duty. That's if somebody has had a violation. And then we have follow-up tests. That's, again, if somebody's had a violation. Now, here's another trivia question.
Bobby, pick a section and whoever needs. Okay.
Yes, we'll start with this one. We're
section?
gonna go this one, right where you are.
We haven't picked anybody in the back.
Trivia question. We're going to go up to the second row up there.
Okay.
Please tell me the name of one of the 3 types of DOT tests that may be ordered. We just talked about 6 different tests. What are the names? Name at least 3 types of tests. 3, yes. Go ahead. Oh, yay! Thank you. You said random, return to work, pre-employment, post-accident, return to duty. Yes, very good. Thank you.
Ask me which one was missed.
Okay, anybody have the idea of which one she didn't cover? Reasonable suspicion. Follow-up testing. And random. Okay.
Who said follow-up? I felt like
on to, does everybody know in here who the medical review officer is? Who's the MRO? The medical review officer is the one who reviews if something comes up on your testing and Kathy's gonna talk about this. Okay. Yeah.
This is one of the really interesting things that happens because Bobby and I, and to some degree too, will get a question about a violation and somebody will say, how do we know a positive is a positive? And all three of us have been in this field a long time. We've heard a lot of stories. The person that determines whether a positive is a medical review officer. So what will happen is that if something comes back in the test, the medical review officer will review it. Now, the next thing that the medical review officer will do is call you to see if there's any reason why the test came back positive. In that event, here's our slide person. You've been working the whole time, so I'm going to give you a gimme. In that event, what should you do if the medical review officer calls you? Yeah, I want to give you the opportunity to have a prize because you've been working the whole time, right? What do you do? If the medical review officer calls you, what do you do? I'm going to give you a hint. Call them back. Call them back. Call them back. Okay, right? Let's give a round of applause for that answer. Woo! Exactly. Okay, because the medical review officer is the one that determines that a positive is a positive. If you have a reason that your DOT test may have come back positive, the medical review officer will work with you, and then they will report it as a negative if there's a reasonable explanation for your positive urine screen. So please call the medical review officer back.
No, we're just skipping some of the other in time. Yeah, as Kathy said, you're not going to get a call. You typically would not get a call from the medical review officer unless the medical review officer had a question about your specimen. And typically they would call you to verify a prescription that you're taking, or if there's some other question. But as she said, you must call them back, and they will continue to call you for several days. At which point, if they don't reach you in a certain amount of time, then they start calling your supervisor and saying, I need you to contact the employee. And then your supervisor or the employer gets a call. So now we're going to go on to what is considered a refusal to test. Refusals include, but are not limited to, a no-show. Somebody just doesn't show at the collection site at the designated time. That is considered a refusal to test. Failure to remain at the testing site until the collection is completed. We've had employees do that. An adulteration. They can tell if you have adulterated the sample. There are ways they can tell that. That's considered a refusal to test. Substitution. You've substituted someone else's urine for your own. We've had situations such as that. In one case, it was the dog's urine. So we've had that situation. Those are all things. And then, or failure to cooperate with any part of the testing process. It's pretty inclusive, and when you're at the collection site, they follow certain procedures. So if they say this person failed to cooperate, then you failed to cooperate. And this is kind of a no-brainer, but always bring your ID with you to the collection site, your driver's license. You wouldn't believe it. I've had employees go there, and then they call me or call Cam, and the employee showed up without their ID, no license, no ID. So, and then on to the next slide. So what will happen what are the consequences if you have a refusal to test? You will be immediately removed from any safety-sensitive functions, not just driving, any safety-sensitive. Then APS policy will determine whether you will be permitted an opportunity for rehabilitation, or you may be terminated. So the APS policy allows for that. And then you will then, again, you cannot perform safety-sensitive duties for anybody under DOT until you have been evaluated by a substance abuse prevention professional and successfully completed the return to duty process. And that includes the DOT return to duty drug and/or alcohol test. So then you will be then subject to follow-up tests. That's one of those other types of tests. Its follow-up testing can be up to 5 years, and the employee who has a violation can be tested up to 5 years in conjunction with the random testing process. So I've had employees who've had a violation who are being tested both in the random testing pool and in the follow-up testing process. So, and then the big question I've had employees ask me, let's say they had a violation with JBL Trucking Company. That's where they worked before they came to APS. And they want to know, when I get hired here at APS, are my results from there going to follow me here? The answer is what? Yes. Why is that? What happens when you apply for the new job? What is APS required to do? They have to reach out to your old job and find out if you had a violation, right, at your previous job driving. So yes, they are required to so if you leave the APS and go work for another school system or another place where your CDL is required, the same thing happens. Your new job is required to reach out to the employment office at APS. You will be asked to sign something at the job you're applying to that says that you are agreeing to this arrangement, that your records go. This is something Kim does. And
So yeah, like Bobby mentioned, everyone sounds like you're really pretty familiar with the procedures already. Oftentimes, people come by EAP personally, drop off paperwork for me to complete facts. My phone number sometimes is circulated around and people just call and ask me to complete something. After you leave the system, you're pretty anxious for that paperwork to be completed so that you can start your new job. So I'm the person to contact when you need requests like that filled. Just one thing I want to clarify, and thank you, Darlene, for reminding me of this. Anytime that you have a random or an annual physical, please be sure to check with Darlene first about the location. We don't want you going to different locations that you don't have an appointment for and get confused about that. So just to reiterate, if you have an annual physical scheduled or a random test, please make sure you check with Darlene first to make sure that you have the correct location to report. Make sense?
Yeah, if you have more questions about
You got the website and the
It's a
phone
great
number.
website, full of information on anything you want to know about DOT, federal motor carriers. They're very open to questions. If you have any questions, a lot of good information on the website there. I know it's more trivia questions.
So as we're wrapping up, and thanks again for your attention. I know it's been a long morning already, but as we're wrapping up, does anyone remember where EAP is located? A lot of people said across from Whitlow's, we'll take it. Half a block from Whole Foods, we'll take it. Thurgood Marshall Building, we'll take it. upstairs from New Directions, we'll take it. Complimentary parking, don't worry about that. All right, one more question. We'll let you get out of here. Can you name 3 EAP staff members? She's like, don't put me on the spot. Don't put me on the spot. I heard someone say Bobby.